नहीं 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 before that. कोई है क्या? Good afternoon, everyone, or should I say good evening? Good evening to all. And gaya.
We can see, Mama.
But I cannot see. Anyway, good evening to all of you. And I went through your queries, which are mainly related to the menstrual cycle. And these queries are quite common amongst the girls, especially during the age 13 to 18. They are quite curious to know what's happening to their body. There are lots of changes which happen during adolescence, and I'm sure all of you have gone through it because most of you would be 17, 18, or 19 years. And both it happens both in boys and girls, and unless the parents or the caretakers tell them about the changes, they feel, is it happening only in me or somebody or the other girls also? I do not know if the girls discuss about it, but it does happen. But if you have a sister, elder sister, you know that she has gone through it, so it's fine. But basically, I feel the caretakers and the mother for the girls and father for the boys to explain. But we had once checked up the fathers who are doctors, and then we asked, how many of you talk to your sons and tell them what's happening? It was so, I mean, when we went through it, it was just 1% of the male who could talk to the sun what changes are occurring and this will occur, all those things. And when I said why the others do not talk, what's up? They will know by themselves as we came to know ourselves. But for girl, usually the mother will tell her once she gets a period or just before the period that now you're growing up, there would be certain changes, and these are the changes so that the girl is prepared for it. I do not know whether all of you have been told by your mother what all things happen. But sometimes I feel the teenagers, they, feel, how can we talk such things with our mother? Maybe with the elder sister they may be talking. I do not know. But they themselves will not go and say this is happening. Yes, when the bleeding occurs first time, that is menarche, onset of the menstrual cycle, then of course in certain sects they have a very good way of celebrating it. Especially in South, we do celebrate that the girl has attained menarche, that is the onset of the uh, periods. And you won't imagine, we were all in Delhi. So when my daughter had her first period, I went and distributed sweets to my neighbors. They said, my goodness, we never tell. You know, it's not good to tell people that your girl has attained menarche. I said, we tell. So this is our custom in Kerala and all. They have like a marriage type of reception and give a party. Whereas in North, it is kept as secret. You're not to tell anyone what has happened. So, and they also consider it as something not so good, dirty. So what happens? Their psychology thinks, oh, why are we having such a thing? Why did God give girls this punishment? All those things I used to hear from the adolescent who used to attend the adolescent clinic, and I was surprised. Now let us talk about the changes which happen on the outside once you are 12 adolescent, 12 or 13 years. The changes are in both boys and girls, but I will emphasize on the girls' changes. You start seeing that you may gain height, your hands and feet grow, grows on the legs, genitals, and underarms, start to produce discharge. There would be a vaginal discharge, and you feel why this is happening. Is there an infection or something else? You don't talk to anyone. Then, of course, the ovaries start producing the eggs. You start the periods, and the breasts grow, hips widen, spots develop, and hair can get greasier or oily. Now, these are the changes which we find adolescence and then the adult. And also, there would be changes. We're not going to talk about the boys. Let us just get into the female, the amazing girls. Let us see what is going on in the inside. Now, see what's happening. Periods can begin happening to a girl as early as 8 years old or as late as 16. What we find nowadays is that girls are getting period very quickly, even earlier than 12 years. After the girl starts puberty, she will start to release one special ova per month. That is what is supposed to happen. But in many of them, the ova may not be released every month. Maybe in once in 2 months, once in 3 months. From the male, if you had uh, intercourse with the boy, then you will, I mean, it will be, there will be fertilization occurring, and the fertilized ovum has to reach the uterus because for further development. And here the embryo gets implanted. Now, what we are saying here, endometrium is the lining of the uterus where the egg which is fertilized will embed itself. Now, if there is no intercourse and no pregnancy, then this endometrium is shed in form of blood, and that is your menstrual cycle. Now, uterus is where the fertilized egg implants and develops into a baby. Sometimes, if there is some problem in the tubes, like infection had occurred or something, sometimes tubal pregnancy can occur, but it cannot go up to the full length of pregnancy. Now you have known that this is the menstrual cycle which happens, and normally this is the cycle which should be there. But as per your questions, now I shall tell. Yeah, Srila will be asking the questions, and then I will reply to those questions. I hope you have understood the menstrual cycle, which occurs monthly, that is 28 to 30 days. Sometimes it goes up to 45 days also, and sometimes 2 to 3 months. That means the hormonal changes are not occurring properly. Usually we say 28 to 30 days. Yes, Srila, what are the questions?
One moment, ma. Can you?
Yeah, yeah.
Okay. The first question is I end up fainting most of the times on the second day of my period. The cramps are so bad. Kindly let me know what do I do to avoid the fainting.
Well, the fainting which you're having is due to the severe pains and cramps.
Okay.
And you may not be taking enough fluids. You have to take enough fluids and should not be hungry. That means you have to take your food properly. And if there is lot of bleeding, then also because your BP would come down, that is blood pressure would come down, and you will faint. It is quite common either because of the severe agony of the pain. Some people faint, and some because of the bleeding, and excess bleeding can be known by passage of clots. So that for that one has to go to a gynecologist and then take the medicine properly. So this is very common amongst the girls, especially during 15, 16, 17 years when the cramps are very bad. So one can also try warm fermentation. That is, you can put a bag on your tummy and then lie down, and also see to it that you drink enough water and eat properly during those days. Though some people also have nausea, so they cannot take the food, we say no, you must take proper food and basically enough liquid.
Okay. Which is better to use, the tampon, pads, or cup? I have regular flow during my periods.
Well, it's up to you to decide what you want. Whatever you put, see to it that within 24 hours you change it. If
Okay.
you keep it for 1 or 2 days, sometimes they do that. Oh, the pad wasn't that wet, so I kept it for the second day. But do you know there's a vaginal discharge also, and that can cause infection. Even little blood on the pad can cause infection. So we always say it's better to change 12 hourly, but definitely 24 hours after that you should not keep, so that the bacteria don't grow on your pad. You will not be able to see the pad on the pad the bacteria is there or not, but there would be a smell, and that means there is some infection is going to come. So it's better to change 12 hourly or after 1 day.
Okay, so whether you have a regular flow or less flow or heavy flow, you can use any of these three, as in we can use any of these three, be it tampon, pads, or cup, but it should be changed.
Yes.
Yeah? Okay.
Thank you.
My face
Now,
is filled with acne, and just before periods, they increase a lot. I have tried putting ointments and creams, but no help. Please tell me why this happens and what should I do?
see, usually premenstrually, the hormones are working and the skin becomes oily. Applying ointments and cream does not help. Washing your face, keeping it dry, that is more important. But those people who are prone to acne will have premenstrually acne. As soon as the acne appears, you know, within a week, I'm going to have the period. But it's there because of the oiliness.
Okay.
Applying ointments and all creams does not help much, because this is a hormonal changes which occur in some females. It's not
Okay.
in every female, but in some female who are already oily, who have oily skin, will have this problem.
Okay. I was having eating disorder before, but now I'm okay. Will it cause issue with my periods?
See, eating disorder means there is something psychologically, and that psychological thing needs to be understood. Why that psychological thing? Because you are trying to see that, uh, I mean, when you are either very unhappy or something to do, there's nothing to do, so why not eat? And it may be small, small bites, but that eating disorder occurs. And eating, now I'm happy that you're not having eating disorder, and most probably whatever you were thinking or wanting or desires, they have been subsided. Now, will it cause issue with my periods? Definitely.
Okay.
Definitely, because when you are thinking, remain, the brain works. It's just not on your thoughts, but it also affects the hormone production. So it can cause heavy bleeding, or it can cause scanty periods.
Okay.
So that is why we say you should not be thinking a lot. You should not be, even you're depressed also, you will find there is a change in the period pattern. If you're very happy, then also you find. So what I want to tell you is there is always an issue with the period as long as brain is affected.
Okay.
Brain means your thoughts and various centers in the brain are switched on. Then certain changes happen not only in periods, also like acne increases, and all those things which you never realize it can happen because of the thoughts. Thoughts are very, very important. So
Okay.
that is why we say have always nice thoughts. I mean, positive thoughts will always be good. Negative thoughts are going to affect your body.
Okay.
Next.
I've been told by people around me that I should not have too many salty things during my
Yeah.
periods. Is there
Yeah.
a scientific reason for it, or it's just a superstition?
क्या बोला?
I have been told by
हाँ.
people around me that I should not
Hmm.
have too many salty things just before my period or during my periods. Is there a scientific reason for it, or it is just a superstition?
No, it's not a superstition. Basically, when you take salt too much, you will have water retention.
Okay.
And as I told you, during periods also, because of the hormones, you are going to have water retention. So it will add to the amount of water retained in your body, which can cause many problems. Because if the water retention is too much in the brain, that can affect. If it is too much on your legs and other places, that can affect. Because it can increase your weight by 5 to 10 kgs. If you take too much of salt, you'll take too much of water, and that's going to cause a lot of problems to you.
Okay.
क्या हो रहा है इसमें?
I have
Oh,
been
uh,
I have been having mood swings lately. I get irritated for smallest of reasons. Sometimes I end up crying or feeling sad. I'm unable to understand why this is happening to me. I'm 25-year-old.
well, these mood swings occur. There are hormonal reasons also. But if your periods are regular, then I don't think there is a hormonal swing. It's basically your thoughts. Some people cannot think positively, they think only negative. Oh, I may not be able to get through this examination. Oh, I am not so good as the other one. All negativity on themselves, that also can cause such symptoms. So be positive and remember, nobody can be like you, and you cannot be like anybody else, because every individual is unique. So just remember and always think about yourself that you are great. Yes, you are great, and your individuality will be recognized by others. But if you try to copy somebody, you're going to have negative feeling. Oh, that person is so smart. That person answers so well. That person can deal with anyone. Why are you getting into it? Better to be that I am what I am, and I shall make myself better, not like anybody else but myself. I will be the individual who will be followed or copied by others. So if you have that image, and if you have only positive mind, I think all these things will not be there.
Okay.
Anything else?
Yes. No. No other questions.
Okay. इसमें दिख ही नहीं रहा.
I stopped sharing. That's why.
Uh-huh.
Now no more questions. Any questions
Okay.
here?